I think for our listeners, it's important that you give some examples of where noetic medicine, because you talked about it, and it's calling and it works. How does it work? So what does it come, where does it come into play? And especially now we're going to talk to the caregivers. There's thousands of caregivers that could be listening to this show. And so for you guys, this book, Healing Beyond Pills and Potions, is a definite must read. And that's why I mentioned the elephant in the room, because, this wasn't a physician. This was a nurse practitioner. This was a guy who was goofing off all the time with the patients, but extending their lifespan as a result of the antics that he played with them, right? And getting their mind off their disease and what in his way, call it his own hypnosis. But give these caregivers who are listening, Steve, some idea of your noetic practices.
I'm happy to do that. And I think it's so important. And for the non-medical people out there, many of you, I would say, have heard doctors misspeak and felt the sort of crushing, damaging impact that a misplaced word or idea can have on your sense of hope and alliance and recovery. And that's why I think this is so important. I'll give you a few examples, beginning with the simplest and then going to sort of the most salient and extreme. All doctors give what's called informed consent. And informed consent requires us to, whenever we're proposing an intervention, whether it's a pill or a procedure or surgery, to speak to the patient about risks and benefits. Now, here's the wrong way to give informed consent, and I'm going to abbreviate this considerably. Let's say that there are risks and that they're bleeding and an infection, and let's just leave it to that, okay? Informed consent done wrong, but compassionately might sound like this. I really think you should have this procedure. Of course, you know it has risks. You could bleed, you could get an infection, but that's rare. And so I'm going to really promote you agreeing to this procedure. Now, a person listening to that, as simple as that seems, is going to feel like darts have been thrown at them, the infection dart, the bleeding dart, where you could just as easily implement a very simple technique. I just call it on the one hand and the other. And I'll demonstrate it to you. We've had our examination, and as a result of that and the various tests, I do believe the best procedure for you is the one I'm recommending. Now, I need to tell you the risks. And on the one hand, there are some people, and I'll throw my left hand out and away from the patient. There are some people, listen, I'm saying some instead of you, who implies might not. So there's the possibility of not getting this. Some people who might have an infection as a result or might have bleeding. On the other hand, now watch what I do. There are many patients, I'm putting my right hand right toward you and looking you right in the eye, much like yourself, Greg, who have a perfectly smooth procedure without complications. And in fact, keep your own blood, every drop of it, in yourself and experience really rapid wound healing. And I'm underscoring that with eye contact with you. Now, that very simple thing can work when you're giving a prescription or a recommendation or prognosis or anything. And it's easy to teach. So, and it doesn't make a difference. Well, yes, it makes a difference. And we know that. I know it from 40 years of personal experience. But we know that because what I just told you is an authority, a white-coated authority, offering just simple words, even a placebo trial, has 25 to 35% effect, if not better. And these refinements in technique allow you to move up the ladder and have more in the neighborhood of 65, 85% effectiveness.